Hello, hi everyone. So welcome to tonight's presentation. And here tonight we have Dr. Shirley Li, who is an assistant professor in the Department of Psychology at the University of Hong Kong. She's also a principal investigator in the State Key Laboratory of Brain and Cognitive Sciences at HKU. Dr. Li's clinical and research interests center on sleep and sleep disorders, particularly sleep disturbance and mental health, and psychological and behavioral treatments of sleep problems in the context of psychiatric and medical illnesses in children and adults. So tonight I'd like to introduce Dr. Shirley Li, who will be talking about taking care of your sleep, especially during this difficult time with COVID. So I'd like to introduce her now, Dr. Shirley. Shirley Li, it's all yours.
Okay, thank you. Thanks, Sasha.
Thank you.
Nice introduction. Hi, everyone. I'm glad to be here. I'm very delighted to be here to share with you some of our understanding about sleep. So as Sasha has mentioned, my clinical and research interests are mostly related to sleep and sleep disorders. So we are interested in understanding how sleep affects our health, our cognitions, our mental health, and our daily functioning in general. So today, so I will first do a brief presentation about sleep. So just to give you some idea about sleep, and then we'll have a more interactive discussion and take some questions from the floor. So first, let me just share my screen. Okay. So I guess you should be able to see my screen now. Okay, sorry. Okay, so let's get started. So we all, I think everyone wants to achieve healthy life, and we know that there are several elements that constitute healthy life, including balanced diets and also regular physical exercise. However, a lot of people might overlook another important element that constitute healthy life, which is healthy sleep. So in fact, we as human beings, we spend 1/3 of our life in sleeping. So one of the questions we often ask is, why do we need to sleep? Why do we need to spend that much time in sleeping? So basically now, based on current science, actually we don't really know the full functions of sleep. So the basic function of sleep largely remain a mystery, and we don't have a unified theory to explain why we need to sleep. However, based on the existing evidence now, what we do know is that adequate sleep is a biological imperative. It is necessary for sustaining life and optimal functionings. And there has been some evidence suggesting that we need sleep for restorative function. And also there is a large body of research suggesting that sleep is important for consolidating our memory, for our learning, and also for our creativity. So one question you might ask is, what control our sleep? So there are two main processes that regulate our sleep. The first process is what we call homeostatic sleep process. Basically, it's just our sleep drive or pressure to sleep. And the principle that sleep drive follow is rather straightforward. That is, the more time that passed after an individual wake up for the day, the greater the sleep drive. So on this slide here, on the right-hand side, you can see a diagram here. So as you can see, when you wake up around 6 to 7 in the morning, you probably have very low sleep drive because you just had a night of sleep. As time goes by throughout the day, your sleep drive will gradually increase, and you will feel very sleepy by the end of the day, perhaps around 10, 11 o'clock. That's the moment when you have very strong, when you have the strongest sleep drive. There's also the time that you would like to sleep. So once you sleep, your sleep drive will go down again. So that's, as you can see, that's really straightforward in terms of how our homeostatic sleep process operates. And one of the advice we often give to patients with insomnia is that they should try to avoid taking naps, especially no long nap during the day, especially in the late afternoon. And the reason is actually related to this homeostatic sleep process. So as you can imagine, if you take a long nap at 4 or 5 o'clock in the evening, in the afternoon, of course, your sleep drive will go down. And by the time around maybe 10 or 11 o'clock, because you slept already in the afternoon, you don't have that strong sleep drive. And it takes time for your sleep drive to build up. So by the time you really want to sleep at night, actually you don't really feel very sleepy. And that explains your difficulty to fall asleep if you have taken a nap during the day. Another process that regulates our sleep is what we call circadian process, or what is known as biological clock. I think a lot of you probably have already heard of biological clock. This is a process that this is a system that actually regulate a lot of our physiological processes. So because we, as human beings, we are actually diurnal animals, which means that we are actually active during the day instead of at night. And our circadian rhythm, or our biological clock, actually regulate our sleep-wake cycle so that we can sleep at night, and then we do our activity during the day. Of course, circadian rhythm also influences almost all of our body system and etc. So our circadian rhythm is actually very important for our survival. Our biological clock for us to know when is the time to sleep and when is the time to wake up. So there are several factors that could affect our biological clock. So as I just mentioned, light is one of the most important factor, and also our sleep, and also daily activity schedule, and also the secretion of melatonin. Melatonin is an hormone I think you probably may have heard of, and it can be a supplement as well, because you can actually buy melatonin as supplements in the commercial pharmacies. Melatonin also can affect our biological clock as well. And also it's important to know that there are individual differences in circadian preference. For example, some people may prefer go to bed later and get up later. They found it easier, or they found themselves functioning better later in the day, like in the evening, where some other people may find them functioning better during the day or early in the morning. So we also have these individual differences in terms of the circadian preference. So as I mentioned, light is important for us, and we can also actually utilize light to adjust our biological clock. So For example, as you can see in this diagram here, for a normal person with normal sleep phase, perhaps he or she will go to bed around 10 or 11 o'clock and then gets up around 8 o'clock. For someone with advanced sleep phase, you can see here, the person goes to bed very early and then gets up or wakes up very early. For this kind of people, we can actually utilize light by providing light exposure in the evenings. Then we can help them to kind of delay their clock so that they will have later bedtime and get up later. Whereas for some people with delayed sleep phase, as you can see, they tend to go to bed later and they tend to get up later. We can also utilize light exposure. However, for this kind of people, we have to provide lights in the mornings after they get up in order to delay to advance their clock so that they can go to bed earlier and get up earlier. So in general, we have some tips for having a healthy biological clock. One most important tips is that you should try to maintain a regular sleep-wake schedule because that will help to stabilize your biological clock. If you have very chaotic sleep schedule, for example, you get up around 10 o'clock today and then you get up around 6 o'clock tomorrow, your brain will get confused. It will probably ask you, what time do you actually want to get up? I get confused. I don't know when I should wake you up. So it will be important for you to keep a regular sleep-wake cycle. And also, for most of us, properly timed and adequate bright light exposure in the morning will be helpful. So you don't have to get some sophisticated light devices. Well, in general, if you don't have very severe sleep problem, just like everyone else, actually just getting outdoor light in the morning after waking up, it will be helpful. And also, similarly, we will usually advise people to avoid excessive electronic device usage in the evening, because as I said, light is important light is important for our biological clock. If we are exposed to too much bright light in the evening, actually you will find it difficult to fall asleep. And that's why in general, one of the sleep hygiene advice will be avoiding excessive electronic usage in the evening, especially before bedtime. So we're talking about, so I think if you attend this talk, you're probably concerned about your sleep. And we know that to have good sleep, this includes adequate sleep, good sleep quality, as well as adequate sleep duration. So one of the questions that people often ask me is that, oh, so how much sleep do I really need? So here in this slide, you can see a diagram that shows you the recommended sleep, the sleep duration recommended by Sleep Foundation. So as you can see here, for newborn babies are sleeping all the time throughout the day and night. But as the baby grows older, our sleep gradually starts to consolidate at night. So as we grow older, our sleep duration also actually gradually decrease. So for most adults, as you can see here, the usual recommended sleep duration is about 7 to 9 hours. However, we also need to note that there are individual differences. So some people may just need to sleep for like 6 hours, but they still feel energetic. They can still function during the day, whereas some other people may need to sleep for a longer period of time. They may need to sleep for like 9 hours or even longer in order to function well during the day. So there are individual differences. in the general population. So what we recommend is that you should try to explore the actual sleep duration you need, instead of trying to push yourself to achieve certain amount of sleep, such as 8 hours. So we know adequate sleep duration is important. However, in modern society, sleep deprivation is actually very common. More than 30% of adults sleep less than 6 hours. And both based on the research evidence, it seems that people are sleeping less and less over time. So this is a study, an online survey conducted across different countries. So as you can see here, interestingly, we can see that Asians actually have the latest bedtime. So Hong Kong is here, and the majority of Asian people tend to go to bed very late at night. They tend to go to bed after midnight. Whereas if you see people from Australia, New Zealand, there are less people who have very late bedtime, especially after midnight. So the percentage of people who go to bed after 12 o'clock are much less as compared to people in Asian countries. And similarly, if we look at the sleep duration, in fact, Asians also have the shortest sleep duration as well. If you look at the sleep duration for people in Australia and New Zealand, in fact, most of the people from most of the Asian countries tend to sleep less than 7 hours. And you can, for here, you can see, here you can see that a lot of people from Hong Kong actually do not get that 8 hours of sleep. So there are a constellation of negative impacts associated with sleep deprivation. For example, on a physical level, if you are chronically sleep deprived, you may experience excessive fatigue and also daytime sleepiness. And that might potentially contribute to the risk of traffic accidents and maybe associated with lifestyle changes. For example, you may have to consume a lot of caffeine, a lot of coffee and tea in order to maintain your alertness level during the day. And also, we know that chronic sleep deprivation could potentially cause metabolic disturbances, thereby increasing the risk of developing obesity, cardiovascular diseases, and diabetes. And on a psychological level, I guess most of us may have this kind of experience before. When we are sleep deprived, we tend to be more irritable. We don't feel good about ourselves, and we have a lot of worries and anxiety. So psychologically, sleep deprivation could also increase the risk of developing mood disorder over long term. And also, I think all of us probably experienced this before as well, when we are not having sufficient sleep. When we are sleep deprived, we found it difficult to concentrate, to make decisions. So sleep deprivation could substantially affect our cognitive performance as well, and also negatively affect our work and academic performance. And behaviorally, as I just mentioned, when we are sleep deprived, we tend to be more irritable. And there has been research showing that sleep deprivation could increase aggression, and also for young children, there is a risk for hyperactivity-like behaviors. So this is an interesting study conducted to illustrate how sleep could potentially affect your social life. So in this experiment, people are shown two kind of pictures, like what you can see here on this slide. So on the left-hand side, you can see a lady with 8 hours of sleep, And then on the right-hand side, you can see a lady with 6 hours of sleep. So in this experiment, people are given these kind of photos and they were asked to rate how likely or how willing they are to socialize with people in the pictures. So what they found is that if you're asleep, so people are more likely to rate those who have less sleep as less attractive, and they are less inclined to socialize with people who have less sleep. So one of the message here is that you should really get adequate sleep duration, because that could potentially affect your social life, affect your attractiveness as well. So some of you may say, oh, I want to sleep, but I just can't. And this leads to another very common sleep problem, that is insomnia. So what is insomnia? Insomnia is presented as difficulty falling asleep, difficulty in maintaining sleep, and also early morning awakening. So it's quite normal for us to experience insomnia symptoms sometimes when we experience acute stressor, when we have something exciting going on the next day, or something stressful going on the next day. So sometimes it's normal for us to have poor sleep. However, if you experience insomnia symptoms for a very long period of time and experience that very frequently, then that means that we really need to look into this, because it is a problem. So clinically, we define insomnia as a problem by frequency as well as duration. So if you have insomnia symptoms for at least 3 nights a week for at least three months, that means that you really need to consider getting some help. Because chronic insomnia could lead to significant adverse consequences in different domains. For example, it may reduce quality of life, it may negatively affect your performance, and it could potentially cause significant negative impact on your health. For example, chronic insomnia may increase the risk of developing type 2 diabetes, hypertension, chronic pain, and also may affect your immune system negatively. And also, most importantly, we know that insomnia could be a very strong risk factor for developing mental health problems such as anxiety and depression. So if someone has chronic insomnia, what can be done? First of all, timely assessment is important because there is a need to understand why there's insomnia, why sleep has been disrupted, and how the treatment can be provided. And first of all, and in terms of the treatment, I think first of all, it's important to have healthy lifestyle and healthy, good sleep, and also to maintain good sleep hygiene. And for some more severe cases, or if the sleep problems are more severe, then we may need to consider certain treatments. For example, cognitive behavioral therapy for insomnia is currently recognized as the first-line treatment for managing adult insomnia. And for some cases, in some cases, the doctor may consider prescribing medication. But in general, medication are usually for short-term use. They are not prescribed for long-term use. For people with chronic insomnia, it's definitely important for them to get comprehensive treatments to manage their sleep problems, because often sleep problems are linked to other issues such as mental health problems. So that's why, as I said, it's important to get timely assessment to kind of differentiate or to understand whether the person also suffers from other mental health or other medical issues. Another message here is that medication alone often are not the sole solution to chronic insomnia. Because sometimes in the cases of chronic insomnia, they tend to have maladaptive behaviors and also distorted belief or unrealistic expectation about their sleep. And these factors could potentially contribute to their or exacerbate their sleep problems. So as this diagram illustrates here, typically when people have insomnia, they for a long period of time, they tend to worry about their sleep. They worry that their poor sleep could potentially negatively affect their performance the next day. So they have a lot of fear, they worry, and that could potentially increase the pressure, increase the anxiety, and as expected, if you have a lot of anxiety, a lot of stress, it will be difficult, even more difficult for you to fall asleep. And subsequently, it may affect your next day performance, and people tend to adopt some maladaptive behavior to cope with their sleep problems. For example, by taking nap, by staying in bed for a longer period of time, by going to bed earlier in order to wait for the sleep to come. However, this kind of behavior actually, unfortunately, can actually exacerbate their sleep difficulties. So it is important to get some treatments or to get timely assessment to find out what might be the contributing factors for the person's sleep issues. So relevant to the talk today is about how does the pandemic affect our sleep. So in fact, there has been a lot of research going on to look into the changes in sleep patterns during COVID pandemics. So as you can see, actually, if you look at the data here, BT means bedtime and WT means wake time. So as you can see across different regions, in fact, people tend to have later bedtime and also later wake time after the pandemic. And interestingly, we are also getting actually a bit more sleep after pandemics. And I guess it is understandable because pandemic has already brought us a lot of lifestyle changes, including working from home most of the time, and actually working from home can actually save our time from traveling, and we may have some more time for sleep. But on the other hand, we also notice that under pandemic, there are also more sleep disturbances. So there's been some research showing that, for example, in Hong Kong, there's one study conducted in Hong Kong, just republished recently. About 30% of people in Hong Kong report sleep disturbances, and about 30 to 40% of people in Hong Kong report their sleep worsened during COVID-19 outbreaks. So I guess we probably have to be mindful that because during the pandemic, we are undergoing a lot of lifestyle changes. It is important to look after our sleep. So here I'm just giving you some general sleep advice. As I just mentioned, it's important to keep regular sleep-wake schedule because that will help to stabilize your biological clock. In general, we don't really advise you to take nap if you want to have good quality sleep at night, because we in general we encourage people to have consolidating sleep at night. Sleep-friendly environments is also important. And also we usually strongly recommend people to keep their bed only for sleep purpose. Try to avoid engaging in non-sleep related activities in bed or in bedroom, such as working or playing with your phone or playing with your tablets and etc. And try to avoid excessive caffeine and alcohol. And before bedtime, it's actually helpful to develop or to maintain consistent bedtime routine, which means that you should have a wind down period just to try to do some relaxing and enjoyable activities, maybe 60 to 90 minutes before your bedtime to help you wind down. That will help you to help you get to sleep easier. So that's basically the presentation. So basically, I will cover most of what I would like to cover today. So the general, in summary, healthy sleep is part of our healthy life. It's important to get sufficient sleep and sleep durations. And sleep quality is also important. When we have poor sleep quality, it's important to also get timely assessment just to find out what has gone wrong. And if you have chronic insomnia, it's important to get early assessment and timely intervention to help you manage your sleep problem. So that's all for my sharing today.
Okay. Thank you so much, Dr. Li, for that very informative presentation. To everyone who's tuned in, I was so eager just now to introduce Dr. Li that I actually forgot to introduce myself. So my name is Sasha Gonzales, and I'm a contributor to the South China Morning Post in Hong Kong. And I'm very honored to be moderating this discussion tonight. Now, Dr. Li, we actually have about half an hour left of this discussion. So if it's okay with you, I'm just going to ask you a few questions about what you've spoken about and some related questions. And then later on, to everyone who's tuned in, if you have any questions for Dr. Li, please feel free to send them through. And if we have some time towards the end, we will ask Dr. Li your questions. Okay, so Dr. Li, now earlier you mentioned, you talked a little bit about the things that are making it difficult for a lot of people to fall asleep, such as spending too much time on our electronic devices right before sleeping. Now, how has the pandemic actually made it harder for us to fall asleep? Can you talk a little bit about that? Because for the last year and a half, a lot of people definitely have been sleep deprived. A lot of us are working from home. We're working actually past 6 p.m., past 7 p.m. sometimes. So, and then worrying about kids and things like that. So can you actually talk about how the pandemic has actually made it a lot harder for people to stick to a regular sleep schedule?
Yeah, I think there were several reasons that we found it difficult to sleep, or we have more sleep disturbances on the pandemic. Mm-hmm. For example, as I mentioned, we have to change our lifestyle style, such as working at home. So sometimes people may try to work in their bedroom or work in their bed. And this kind of habit is actually not good for their sleep, because mm-hmm. want people to. It will be helpful for them to avoid sleep incompatible activities in bed, because we want our bed to be associated with sleep only, instead of other non-sleep related activities. Because as you can imagine, if you're always working or thinking or planning or doing other activity in your bed, your bed is gradually becoming a place for you to do other things instead of for you to sleep. So in order to consolidate the link between your bed and your sleep, it's definitely important to avoid doing things like non-sleep related activity in your bed. And also, I think because we are staying at home most of the time, we're doing less activity, outdoor activity, we're getting less light exposure. We are also maybe doing less exercise. So that will also affect our sleep as well. So I guess, and sometimes when we have poor discipline, we may not have regular sleep-wake schedule. So that could also affect our biological clock and make it difficult for us to sleep.
Okay. How would you actually define a good night's sleep? Like earlier, you mentioned that it's very subjective how many hours we need. Some people are okay with 7 to 9, some people 10 hours, some people are okay with 3 or 4 or 5 hours, So how do you know once you've woken up that, yeah, I've had just the right number of hours last night?
Yeah, I guess as you mentioned, and for presentation as well, actually sleep is very subjective experience. There's no absolute criteria or that suits everyone. So we really need to kind of think about how much sleep we need, like on an individual basis. And the way one way we can think about it is to look at our daytime functioning, to see whether if you always doze off during the day, perhaps you're not getting enough sleep at night. Or if you always feeling sleepy, perhaps you're not getting adequate sleep at night. So that's one way we can kind of explore whether we are getting adequate sleep at night.
Okay. How can sleep deprivation affect us on a long-term basis? So, like you mentioned earlier, we might be irritable when we wake up, we might be a bit cranky, we might have trouble focusing, but over a long-term basis, if you're talking about decades of sleep deprivation, how can that actually affect us emotionally? How can it affect our brain, our memory, things like that?
So basically, like it can over the long run actually the sleep, because there has been a lot of research conducted to look into the effects of sleep deprivation on our health. So there has been studies there have been studies suggesting that chronic sleep deprivation could lead to increased risk of cardiovascular disease. Like they compare people with shorter sleep duration versus normal sleep duration, and they found that over time, those with sleep deprivation have higher risk of developing obesity, cardiovascular disease, diabetes, and also mental health problems. So I think this part of evidence is quite solid, and we know that that's why we know getting adequate sleep is very important for our health.
Okay, and then my next question: can we talk a little bit about napping during the day? Because I have read that naps are good for you if you want to take a power nap during the afternoon. It actually helps boost your energy. It helps you focus. It gives you that rest you need at the middle of the day. But what do you think about napping? Personally, what's the ideal length of a nap, and when's a good time to nap if you really have to during the day? What's a good time in the morning or in the afternoon?
I think in general, if for someone with sleep problems at night, like for example, for someone with insomnia, we definitely would advise them to avoid taking nap during the day.
Okay.
Because that will affect their nighttime sleep, make it more difficult for them to fall asleep. And in general, for people, like some people, they will complain that, oh, I don't have the opportunity to sleep at night. I do need to keep my alertness level in order to perform, to function. I really need a nap. Then we will say it will be better to take the nap earlier during the day rather than later in the afternoons. And also brief nap will probably be better than long nap. Brief nap will be like 15 to like half hour, something like that, instead of like 1 or 2 hours, because that will certainly affect your sleep drive, make it harder. You probably, as I mentioned, because you have to build your sleep drive. It's just like sometimes I use the metaphor of flushing your toilets. Your sleep drive is the water in the tank. So if you flush your toilet in the afternoon, then you have to wait until the water in the tank to rise, so that you can flush it again. So it will be better for you just to wait to the later at night, and then you can just flush it all at once in order to get consolidated good sleep.
Okay. And similar to the question I just asked, what about sleeping in on your days off? Or sometimes people just want to sleep in on weekends, is that ever a good idea? And how might that affect your sleep later on that day?
I think that's definitely a good question, and a lot of people will ask that question, especially working adults, because during the weekdays we're really busy, we don't have time for sleep. So what we do is try to compensate by sleeping longer during weekends. But in fact, if we don't really recommend having such a discrepancy in sleep duration between weekday and weekends, because that will affect your biological clock. As I just introduced about biological clock, in fact, you want to have regular sleep-wake schedule because you don't want to get your brain to confuse. Otherwise, sometimes if you get up at 10 and then sometimes you get up at 7, your brain will confuse. So what time do you really need to get up? And also, I think most of us have that experience before. If you slept in, that is, if you sleep for a very long time and you woke up very late on on Sunday, you will find it very difficult to fall asleep on Sunday night. Then you struggle and you wait, eventually you fall asleep, but then you still have to get up early on Monday. Then your sleep deprivation cycle starts again. So usually we don't recommend sleeping in. We usually recommend people to kind of keeping adequate sleep
duration, the same schedule
consistently throughout the week.
Okay. I've just had a question in from Alice Mong. So she would like to know if you could share some tips for getting through jet lag. So I know with jet lag, that really upsets our biological clock, especially if we've been flying for long hours and we're arriving in a different time zone. So how can we get over that?
I think this is a good question. I guess it will be helpful to because it really depends on it also depends on where you're flying from or where you're flying to. You're flying to Europe or versus you're flying to US. The level of social jet lag could be different, like the degree of social jet lag that you might experience might be different. You might find it easier to sleep if you are flying from Hong Kong to Europe versus from Hong Kong to US. So normally, I guess the general advice that I can give is just to try to expose yourself to bright lights after waking up. Like after you arrive at place, every morning try to expose yourself to bright light in the morning after waking up, because light is one essential cues to entrain our biological clock. Because when you're at a different place, you want to entrain your clock to the local time. And light in the morning can actually help you reset your biological clock. So I think in general, bright light in the morning after waking up will be helpful. That's the general advice I can give. Of course, some people will use like melatonin, but that's more complicated. So probably it will be discuss that with the doctor if needed.
Okay. And the next question, can you talk about how shift workers can get quality sleep? And especially now, I would say that we have a lot of doctors and nurses cleaners, people working in security, who are really working very long hours, during the pandemic, making sure we're all safe. And, they would be really sacrificing their sleep. So how do you suggest they get quality sleep and maybe get their sleep schedules back on track, especially if they're working really crazy hours or really long hours?
Yeah. Ironically, we're trying to ask people to get good sleep, but actually, healthcare professional a group of people who are often sleep deprived.
Yeah.
So usually, so I guess if you really have to do shift work, we will suggest people to avoid frequently rotating shifts because it would it will be difficult for your biological clock to adjust. And if you really have to do shift work, perhaps it will be easier to rotate from like day shift to evening to night rather than the reverse order. And also try not to work a number of night shifts in a row because it's more likely that you will feel increasingly more sleep deprived. So sometimes it may be better to schedule some days off in between your night shifts. And usually, of course, we cannot avoid, for some people, they cannot avoid shift work. Then what we will advise people to do is to keep your workplace, to get yourself exposed to bright light at your workplace. While you're doing your shift work. And on your way, after you finish your shift work, like for example, on your way home from work, you should try to avoid bright lights. And you can wear sunglasses or a hat to shield yourself from sunlight on your way back home. And while you're sleeping during the day, try to use blackout blinds or heavy curtain to block sunlight when you sleep during the day. So that's some of the strategies that we will advise people to try if they really have to do shift work.
Okay. Now things like drinking alcohol at night, having something that's caffeinated late at night, whether it's a cup of coffee or an energy drink or soft drink, exercising too close to bedtime, so like going for a jog in the evening. Now, how do these affect our ability to sleep? How do they prevent us from winding down?
You mean drinking alcohol or
Yeah, having a drink at night, having a cup of coffee at night, or whether it's exercising at night, because a lot of people they do, they might decide to go to the gym in the evening, or if they go out with friends and have a glass of wine. How do those affect our ability to fall asleep at night?
Okay, I think drinking and exercising may be two different issues. For drinking alcohol, like some people may try to drink in order to sleep, because alcohol can have that sedating effect. It does help us to feel sleepy,
Yes.
to fall asleep. But the consequences is that we will have broken sleep later on, and because it will disrupt our sleep quality later on, when alcohol metabolized. And also, if you drink a lot of alcohol, you will have to go to the toilet. It will also disrupt sleep at night. So usually we don't recommend using sleep as a way to cope with sleep problems because that's counterproductive. And of course, maybe you are just drinking for social purposes, which is fine. Just don't drink right before going to bed. And in terms of exercising, I think we usually don't recommend doing exercise like 1 or 2 hours before bedtime, because normally your temperature will gradually drop as you entering your sleep phase, as you're going to sleep. If you do exercise right before bedtime, you probably feel really hot because you just sweat, and you feel really hot. You need some time to calm down. So it will make it a bit difficult for you to fall asleep. So we'll recommend exercising like during the day, but not just before bedtime.
Okay. What are the ideal conditions to help us fall asleep? So we're talking about the temperature of the room, how, can we have a little bit of noise in the room? Can we have a little bit of light in the room? I mean, what are the perfect conditions to help us fall asleep faster?
So in terms of temperature, it will be good to have cool environment. So because as I mentioned, as we sleep, our temperature gradually decline. So if the environment is cool, then it actually helps us to feel comfortable. And in terms of the lighting, I think it will be helpful to keep it dark. So just try to use heavy curtain to block all the lights, and try to avoid having lights in your room. I think that would be better for as a good sleep environment. I guess in terms of noises, it really depends on individuals, because some people are more sensitive to noise, and where some other people are fine, they can just go to sleep right away despite the noises. So that really depends on different people.
Okay.
Of course, quiet, it would be good.
Okay. What advice do you have for people who do feel tired when they go to bed, but they just can't fall asleep? Because they just have so much on their mind sometimes. And I mean, does counting sheep help, or should they just lay there and try to force themselves to sleep, or what would you suggest? Because their bodies really are exhausted, but sometimes they just have a million things going through their mind, and that's preventing them from actually nodding off.
Yeah, I can totally understand. Yeah, this actually what people have been complaining when they struggle with their sleep. So they might say that, oh, their mind cannot shut down. They have the racing thoughts, they're tossing and turning in bed, well, although they feel really tired. Usually we'll suggest people to have a wind down period, and during that period of time, try to engage in some relaxing activity, because instead of instead of doing work, because it takes time for your brain to shut down. We are not like turning off it. When we sleep, it's not like turning off your telly. You can just unplug and then just go to sleep right away. It takes time for you to feel sleepy and then gradually get to sleep. So in order to prepare yourself for sleep, it will be helpful to have a period of time that you can do some relaxing activity to kind of wind down yourself. And instead of just go straight from working to sleeping, because you will continue to think about your work, to think about what is going to happen the next day. And also it's important to differentiate feeling tired and feeling sleepy. Feeling tired is not a signal for you to go to sleep, but feeling sleepy is a signal. So sometimes if you just feel tired, perhaps you can just sit down and do some reading instead of just go to the bed straight away. I think that's the advice we will usually give to people.
Okay. And would that be the same kind of advice you'd give someone who tends to wake up in the middle of the night sometimes and can't go back to sleep?
So for those people, we'll also suggest them to leave their bed or leave their bedroom to do something relaxing. And then once they feel sleepy again, they can return to their bed, because we don't want them to develop a habit of thinking or planning in their bed. We want them to sleep in their bed to strengthen an association between their sleep and their bedroom and their bed. We don't want them to develop a habit that they often engage in difficult thoughts, intensive planning, or thinking or ruminating in their beds, because that means eventually the bed will become a space for them to ruminate, to have difficult feelings, and etc.
Okay. So to everyone who's tuned in, we have about 5 minutes left. So if anyone has any questions for Dr. Li, if you could just send them in now, that would be good, and we can manage to cover them in the next few minutes. But if not, Dr. Li, I actually have a couple of other questions for you. So earlier you mentioned in your presentation that sleep medications are not a solution for people who have trouble sleeping. So what are your thoughts about those over-the-counter sleeping aids like melatonin and some people drink chamomile tea, which I guess is not harmful at all. But if you're talking about melatonin pills, like, do those work? And I mean, are they safe to take on a long-term basis?
So in terms of the efficacy, of course, their effects are mild. For example, for melatonin, their effects is really mild, and there's not much evidence to suggest all those like alternative approach like traditional sleep medicine or aromatherapy, etc. People may find it helpful, so we'll probably just say, if you find it helpful, it's okay to go for those approaches as long as you find it helpful for your sleep. But currently, the strongest evidence points to cognitive behavioral therapy for insomnia, because because based on the research evidence, we know that insomnia is often maintained by certain mindset and also maladaptive coping behaviors. For example, by sleeping, by lying in bed for an extended period of time while not sleepy. Like this kind of behavior actually are counterproductive. So currently, the strongest evidence points to cognitive behavioral therapy for insomnia, whereas for other treatment approaches, there may be some evidence, but they're not very strong. And in terms of melatonins, there are not enough data to suggest the long-term safety for the use of melatonin. Although there has been some data for children to use melatonin, but I think the evidence is not enough to provide a solid conclusion.
Okay. And the last question from me tonight, Dr. Li, is how do we train ourselves to sleep and wake up at the same time every day?
I guess
you just have to stick to a particular time every day and every morning to sleep at and wake up.
Yeah, I guess to start off, it will be helpful to set an alarm every day to get up at a particular time every day. And because it's difficult for us to set a time to fall asleep. Like from the beginning, it will be difficult for us to set a time to fall asleep at a particular time. So if from the beginning, it will be helpful to set a time for us to get up, because that's something we can control, but it's difficult for us to control the time we actually fall asleep. So we usually just recommend people to fix a time to get up. So set alarm and get up consistently every day, and gradually aiming to go to bed around the same time every day. So that's what we would recommend.
Okay, thank you so much, Dr. Li, for your presentation tonight. And thank you everyone for tuning in. And we hope you enjoyed that presentation from Dr. Shirley Li. And I guess we'll say goodnight to everyone now.
Okay.
And thanks for joining in. Thank you.
Okay, thank you.